Hi, I'm Jen Angot from the marketing department here at Henry Ford Allegiance Health, and we are here again to talk about heart failure with Dr. Brajesh Patel, cardiologist from Henry Ford Allegiance Cardiology Michigan Heart. So Dr. Patel, can you just start out by just reminding us what is heart failure?
Sure. So first of all, thank you for allowing me to talk about this very important topic, which is heart failure. So what is heart failure? Heart failure occurs when the heart is not able to meet its body's oxygen demand, and our body is made of a lot of cells, and when they get deprived, they cause multiple symptoms, including shortness of breath. And it is a big topic in medicine because almost every year we add about 500,000 of cases on top of 5.7 million of cases already existing. So it is a big issue.
Absolutely. So if a patient has heart failure, what is the best way for them to manage this disease?
Yeah, so the first way is to identify the disease itself. So I recommend patients to talk to their primary doctors, specialists like cardiologists, to learn more about it. And the management starts with simple, dietary changes. Let's say if they consume a lot of salt, we recommend them to limit to less than 2 grams or 200 milligrams. Sometimes it's very difficult nowadays to understand how much salt in food is. So I really encourage them to read labels. That will definitely help, and look at the serving size. Sometimes the salt amount may look smaller, but if the serving size is too much, then just count into that. Another way of managing is medications.
Okay, great. So most patients are then going to be on medications, most
Correct.
heart failure patients.
Correct.
Can you talk about what those medications are?
Yeah, so there are many classes of medications, but patients who already have heart failure, they may recognize that there is something called water pill or diuretics. That's one class. There are some other class of medications which overlaps with high blood pressure medications, such as ACE, for example, lisinopril, ARB, angiotensin receptor blockers, such as losartan. There's another one called, it's new in the market, and it's based on the recent study published. It's called Entresto, which is a relatively new drug, but it's very effective. There's another class of medication called beta blocker, metoprolol, Coreg, or carvedilol, which are some of the examples.
Okay, great. So does a heart failure patient follow up with their primary care physician or a cardiologist, or what do you recommend for your patients?
My philosophy is that they should see both, but I think primary care physicians play a very important role because it's unlikely that patient has only one disease, which is heart failure. They may have diabetes, high blood pressure, and other comorbidities which needs to be managed. And generally speaking, we are in communication with primary care physicians through technology nowadays, so we keep them up to date on any medication we changed, and they also sort of reconcile everything for the patients. And I think it's very important that patient sees a primary care physician.
Great. So what are some of the greatest barriers that a heart failure patient is going to experience while they're trying to manage this disease?
Yeah, I think understanding the disease itself, and people, they have access to internet nowadays and a lot of resources when they come into the hospital or clinic. But I see that sometimes patients not very fully aware of what heart failure is and how they can manage. And nowadays there are tons of literature, and one of the website I can think of is American Heart Association. They do a pretty good job, talking about in layman's term what heart failure is and how they can manage. Another thing is cost of the medication. We work with patients very closely. In terms of, if they can't afford certain medications, we find substitutes. Third thing I would say is just general access to the healthcare in general. So maybe some patients may not have ability to go to the doctor's office or seek appropriate care.
So I know that this disease can probably be difficult to manage.
Yes.
Kind of on your own. Can you just talk about what a caregiver's role is, and how that kind of helps a patient?
Yeah. Caregiver in general is speaking, it could be anybody, including spouses, son, daughter, neighbor, friend. They play a very important role. First of all, they can motivate patients to stay compliant with medications, low salt diet, fluid restriction up to 1,500 to 2 liters, 1,500 mLs to 2 liters, I should say. And they can also provide access to the doctor's offices. And, I think caregiver is just effective as medications, in a sense, in my opinion, in terms of, they can really help patients motivate to do things. In fact, since you mentioned that, we are starting something called Caregiver College. It's about 6 weeks program and maybe 2 hours per week type of sessions. It's not started yet. I think we'll start sometime soon. This is focusing on caregiver who have relatives with heart failure.
That's great.
Yeah.
So it's just going to help, educate them on how to provide support and,
Yes.
just that
And
extra care.
and our goal is to teach them about heart failure itself, so they know what they're dealing with.
Perfect. That's great.
Yeah.
Well, this has been really great information again. Thank you so much.
Sure.
Thanks again for tuning in. Dr. Patel is going to be part of our Heart and Vascular Expo coming up next Saturday, February 23rd. It's from 8 to 1 p.m. It is a free community event. We're going to have lots of health screenings and different booths to set up just to educate our community on how we can be the healthiest and all of that. So we're looking forward to hearing more from Dr. Patel there. And thank you again for joining us. We'll see you guys soon.
Yep, see you there.